you're going to get some below average scores, and that's fine because our goal is that everybody graduates from medical school and becomes a really competent, amazing, capable doctor. Our goal is not to weed people out. And so if you're running with the top 99%, then you're doing great.
Hello there. We are here with another fantastic guest, Dr. Megan Osborn. I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
Yes, thanks for having me. I appreciate it. So I'm Megan Osborn. I grew up in Southern California and I went to undergrad in San Diego. And then I took a year off, a gap year, and then joined UCI School of Medicine back in 2003 and did my medical school then and did residency training in emergency medicine, also at UCI, UC Irvine. And then I did an academic emergency medicine fellowship, got my master's in education, and I've been faculty here at UCI since 2011.
Wow, that seems like quite a journey. And one thing that I'm happy that you mentioned was that you took a gap year because a lot of students are pretty anxious about what they should do and if they should go straight through and all of those kinds of things. So, what are your thoughts on your personal experience and what you've seen other students do?
I am a huge advocate for gap years. I actually think students should do 2 gap years. That's always my advice. And the reason I say to do 2 gap years is for a few reasons. So, number one, the one thing that's really hard when you're applying to medical school to make up for is your GPA. And so, if you don't do your GPA right the first time, that can be really hard to recover from that. If you, for example, if you get a 3.0 in undergrad and you have 80 units in that 3.0, to get that GPA up to a 3.5, it's going to take another 80 units at a 4.0 in order to raise that GPA. So I always tell students, try to focus on academics during undergrad. If you can get involved in some things, that's great, but you don't want it to sacrifice your academics because that's the hardest thing to make up for when you're applying. So then I always advocate for a gap year because that's that time that if you weren't able to get involved in a lot of activities, you weren't able to do a lot of clinical work during undergrad, you can do it during those gap years. And I think that it's good to take 2 gap years because the second gap year is while you're in that application cycle. And so it's a good idea to use that first gap year to get a lot of clinical experience. And then you can get letters of recommendation from those experiences. And that way you'll have those letters ready for when you apply that following May or June or July. And so then that second gap year is the year that you're applying to medical school.
I love that advice. I think that a lot of people get caught in checklists and having to do certain things, but it's okay to take your time. It's okay to explore.
Absolutely.
And then when you're getting these experience through your gap year or gap years, it may let you know that there's something else you're interested in. Because I love telling people, and it sounds weird because we're talking on a podcast trying to encourage people to go to med school. But if there is absolutely anything that you could think about doing besides becoming a physician, try that first, and then if it's still pretty hard, go for it.
Absolutely. I totally agree. If there's something else that you find out you're passionate about along the way, that's great. It doesn't, just because you're on this journey doesn't mean you can't get off the train at some point.
Absolutely. So you mentioned like you've been at your institution for a while. So not only are you the Associate Dean of Students, you're the Vice Chair for Education for Emergency Medicine and Associate Professor of Clinical Emergency Medicine. So as we know, a lot of the listeners out there are pre-med. What are a few things that you note when looking for a successful applicant to come into the school?
It's really varied in terms of who I think is going to be successful. I think there's some academic minimums that we're looking for, and those academic minimums are just making sure that when we see that MCAT score, that GPA, that we think that you have a good shot at succeeding in our curriculum, because we don't want to bring someone in who struggles and figures out that medicine isn't for them or the academics aren't for them in the middle of med school, because you've invested so much time, so much money in this process, that we don't want that to happen. So there are some academic thresholds that we think that students need to meet. But once you meet those academic thresholds, it's really about the person that you are. And we're looking for a class that's very diverse in terms of experiences, in terms of stages of life, in terms of where they've gone to undergrad, where they come from. And so there really isn't one applicant who I think is more successful than another. I think there are some checkboxes, like you said, you mentioned the word checkbox. And I think that that's like sums up being a pre-med in one word is checkbox, because there's so many checkboxes that you feel like you need to do. And some of those are research experiences, clinical experiences, those academic benchmarks of GPA and MCAT. But once you have those, I'm going to use checkbox for lack of a better term, once you have those done, now it's about who you are. And I love seeing something different in everybody. So I love seeing student athletes. I love seeing people who were involved in their associate student body, who did a leadership role of some sort. I love students who are involved in clubs like SNMA or Black Student Union or Latino Medical Association, Medical Student Association. Just any sort of involvement in your school is great. I love seeing orientation leaders and resident advisors and people who were on their school's curriculum committee, or people who started some really cool volunteer experience. So I don't think that there's one thing that students have to do. It's just that I want to see that you're involved and that you're a fun person to have in our class, someone who's going to contribute, someone who's going to make it better.
Absolutely. And that's a great thing. Like, of course, you have to hit the metrics that will make you more likely to succeed in medical school, but the rest of it is about being yourself. Like, why are you going there? You're kind of not only hoping that someone will choose you, but you're kind of choosing your people that you'll be affiliated with for at least the next 4 years, even longer. A lot of my friends from med school are still some of my best friends because you're going to spend a lot studying together. So yes. And life definitely happens. So where are you going and what do you have to contribute and what do you want to showcase for the institution? Because it'll become a part of your life too.
So true. So true. And yes, I have plenty of friends that I went to medical school with who I still call on for advice when for inpatient care, and then just for general friendship.
Absolutely. So as you mentioned, medical school, for the lack of better terms, is a different beast. Like, there are a lot of things that may come up both academically, time management, all of these different things. So once they kind of cross over from becoming an applicant to becoming a student and they hit M1, what types of things would you recommend to help students thrive?
That's a great question. And I think one thing that helps students thrive is humility. and I say that because hard to come into medical school. I think that you were used to being the top of the top, right? Like, you were valedictorian, you were magna cum laude, like you've been everything for the last 22, 23 years of your life, right? And I think it's hard to come into medical school when it's 113 other people who have also been the top of everything since they were born. And that's a hard environment to transition into. And I see a lot of students who have imposter syndrome, a lot of students who are like, should I be here? I got a 75% on the test. I'm not doing well. And I'm like, you're doing great. That's awesome. Congratulations on passing the test. And so I think that one thing that students need to be okay with is the fact that they're not going to be the top of the top, and that's okay. And they are the top of the top by just simply being in medical school, but you're going to get some below average scores, and that's fine, because our goal is that everybody graduates from medical school and becomes a really competent, amazing, capable doctor. Our goal is not to weed people out. And so if you're running with the top 99%, then you're doing great. And so I think humility is one of those things. I think that you have to have some self-compassion and grace and just allow yourself to just learn for your patients and not learn for the competitiveness sake, and not be expecting that you're going to ace every test. And so with that as well, I think we get a lot of students who, obviously medical students are brilliant, right? And so with that brilliance has come some really bad study habits because you're so brilliant that you've been able to just get through undergrad with study habits of pulling all-nighters the night before exam because you're so smart that you could just do that, right? And so I think that when you get to medical school, that doesn't fly anymore, because this is lifelong learning. This is things that you're going to need to know for the rest of your life. And so in study habits that allow you to have spaced repetition and go back to things And the study habits that you use during undergrad might not be those study habits that are going to be successful in med school. So reach out. And if there's a learning skills center at your med school, be okay with meeting with them and learning those study skills. Just because you're meeting with the learning skills center doesn't mean that you aren't going to succeed without them. It just means that you're going to succeed with them. And maybe you learn to be more efficient so that now you can spend more time at the gym, right? Like, so now you can have an hour in the morning to go to the gym that you wouldn't have been able to do if you had less with study habits that weren't quite as efficient as you want them to be. So I think that seeking support early on in medical school, getting those learning skills down and meeting with a learning skills center so that you can be really successful and efficient in your learning, because you don't want to be studying for 18 hours a day, right? Like you want to go to class, you want to get your study on, and then you want to go have dinner with your friends once in a while and go to the gym and go for a walk and see your family. And yeah, in medical school, it's a lot of time and it's not going to be a 30-hour work week, right? It's going to be a lot more than that. But at the same time, how can you be as efficient as possible in your studying so that you can have some wellness built in as well?
Those were all excellent points. Number one, the humility. Like, you are all great. You all made it across the finish line. Like, the competition is over. Like, everyone will have their strengths. Yes, you may notice that someone always comes in and they are out of that test in 10 minutes. And you might need the whole time and you're like, what is wrong with me? There's nothing wrong with you. Like, everyone has their own different strengths and things like that. So theirs may be test taking, yours may be more at the bedside. So it all kind of evens out when you go through medical school. And as long as you're getting the information and retaining that and learning and putting it to practice, you're fine. And then I also love what you mentioned about sometimes you may need to readjust your learning styles. You may have to change things that you did in undergrad that may not work in medical school. You have to actually learn the information. It's not all memorization. So don't be afraid to ask for help. Don't wait until it's too late, and don't be embarrassed. Like, yes, you may have been the tutor in undergrad, but sometimes you might need a tutor, and it doesn't mean that you're going to be a bad doctor, that you're not going to know your information, all of those kind of things. It can actually help you and help you create study skills that will move you forward in the future. Because as you mentioned, medicine is a lifelong career of learning where you have to keep taking boards and board certifications and recertifications. So you'll be studying for the rest of your life. So
absolutely,
it's okay
so true
to tweak that kind of stuff.
Absolutely, so true.
So my other question for you, we were talking a lot about the preclinical years, but how we're in this realm right now where we're recording, it's August. This will probably be out a little later for you listeners out there, but when you transition to clinical rotations, how would you recommend that someone succeed there?
I think the transition to clinical years is great, but it's hard in some respects too. And that's a great question. So one thing that I know that's a lot difference between the first and second, for us, it's the first and second year, and then transitioning to the clinical year, is in the clinical years, you're really responsible for learning what you need to learn. Whereas in the first and second year, I think you get told what you need to learn, right? So there's classes and there's podcasts and there's outlines and there's syllabi. And so you are going to know, or at least be familiar with, every topic that's going to be on the test. And even for step one, when you're preparing, a lot of medical schools are teaching such that you're going to pass step one. So if you didn't even open a review book for step one, but you just did really well in your classes, you're probably going to do great on step one. And so I really feel, and I'm going to use spoon-fed for lack of a better terms. It's not spoon-fed, but we're giving you the information that you need to know for the test, so to speak. I think in the third year, you really have to figure that out for yourself. And so sometimes students go in and they take their first, we have shelf exams at the end of every rotation. I don't know if you did too when you were a med student, but and they're not as successful in the shelf exams in the third year as they were in the first and second year. And it's because they haven't quite figured out that they need to be studying in addition to doing questions, and in addition to taking care of patients. And so the number one thing that I hear from students when they don't do well on a shelf exam is, I'm not sure what happened, Dr. Osborn. I did a ton of questions. And the questions work really well in the first and second year when you're getting that material and you're getting a foundational knowledge. But question reviews don't work well if you don't have that foundational knowledge. So I think the thing for third year is have some sort of compilation or book or some sort of list outline that you're going to cover in each rotation. So let's say it's internal medicine, and you could use first aid, you could use whatever book you want to use, but just make sure you have some sort of outline for the topics that you want to cover during internal medicine for that shelf exam at the end of the rotation, and make sure you're touching on those. And so you can go to Up to Date, or you can go to Medscape, or whatever source you want to use to learn about those topics. But if you can kind of write those down or put them in your Anki cards or whatever you want to do to make sure that you have that foundational knowledge, so that when you are doing questions and you are reviewing for the shelf exam, that you have at least learned the material on first pass. So I think that's the main advice that I have, is make sure that you have a plan for learning all the material that you need to learn, in addition to doing review questions and in addition to doing the didactics that you're going to do. The didactics aren't going to cover everything that you need to know.
Absolutely. I couldn't have said it better. And I love that you mentioned not necessarily like spoon feeding, but like you guys, like your institutions are setting you up for success. So
Absolutely.
It's going to be kind of a stepwise fashion. So they're kind of getting you acclimated to thinking like a physician and thinking through the processes in the bodies in those first preclinical years. So you'll have your exams and all of those kind of things. You'll have to take your boards. You'll have to figure out what your study styles are. But then you're going to get a little more responsibility, and you're going to have to kind of apply what you learned in real life and then learn from those like while you're on the wards. But you're also going to have to work on that time management, where you still know that you're going to have to take that shelf exam at the end of your rotation. And then at the end of the second year, you'll have to take your USMLE step. So you're going to have to figure out how you cannot kind of wait and kind of crash and study for that month or so, but study longitudinally so you can see how to apply it. And then it just keeps going. So when you get in residency, you're going to have, they're not 40-hour calls anymore, but like you'll have call and you'll have to stay overnight in the hospital, and you'll have to figure out how to manage that time and study and stay abreast of things. So it's all kind of helping you kind of get to that next step, and you have to take a step back and kind of realize like, what is my purpose? What is my goal? What am I learning? And why are they teaching me these things? And then if you're looking in these books, like, how can I apply this to things clinically?
Very true. Very true.
So, since you are a leader in medical education, I would love to hear your perspective. If you had a magic wand and you can change anything about the way that the medical education system works, what would you change?
Oh, that's a great question. So I would love like a magic wand to just do everything that I want to do in the curriculum. I think it would be so fun to just start a medical school from scratch. And I'm a big advocate for engaging learning opportunities. So I love team-based learning. I love small group learning. I love sim, oral boards. I love games. I love gamification. It's so fun, like doing fun things with sim and stuff like that. So if I could just design a medical school from the ground up, that would be so much fun if someone would just pay me to do that. And just start from scratch and just like design every single class so that it all ends up in patient care. And I know that it all does, but sometimes I think students don't necessarily see the direct correlation. And so if we could have, for example, every single class be, okay, here's your 30-minute didactic on this particular topic. And that's maybe in a podcast, or maybe that's live in lecture, or maybe it's a 20-minute didactic. I'm not sure. And now let's apply it to a team-based learning scenario where we're going to talk through some cases, and we're going to talk, maybe we'll have some multiple choice questions to kind of review what we talked about in that didactic. And then we'll talk about some cases. And then after that, we're going to have a sim tomorrow to make sure that you learned everything that you needed to learn in that didactic. And we're going to apply that knowledge. And then the day after that, if a patient came in with that exact diagnosis and you had to take care of that patient. So I think it would be really fun to really design medical schools intentionally. I think that we are change has been slow in medical education in terms of 50 years ago. It was a lot of just lectures and reading out of books, and the makeup of the classes didn't look like how they look now. And so there were a lot of things that needed to change, but it changed very slowly. And so we have a lot of old habits in our medical education system. So I think it would be so fun to just, blow it all up in a very figurative sense and just have this amazing medical school curriculum that touches on all the topics that we need to be covering today too, right? Like there's so many more we're going to call them non-academic topics that are so important, like social determinants of health and stuff like that. And so if we could marry all that stuff in a really cool, fun, engaging way, I think that would be the best.
That sounds like a phenomenal school that I support you opening. The exciting part is that there is so much change going on. We're in a healthcare revolution right now, especially with technology. There are some digital agents and stuff that are coming out that help with med school and gamification. So it'll be really interesting to see over the next few years, what types of things do get implemented and incorporated into the curriculum. So we'll see.
Yes, absolutely.
So it was so lovely to have you on our show. I just want to give you an opportunity to tell our audience goodbye.
Well, thank you for having me. It's great that you're doing this. I'm so happy because I think that there aren't enough resources out there for pre-meds and med students, and especially free resources. It's so that everybody can have this opportunity, not just people who can afford to pay for it. So I'm so glad that you're doing that. So thank you so much UCI is a great school to go to medical school. I think our students are so fun, and I think our faculty are really great too. So I would love if you all applied to us, and we'd hopefully interview you and see you at some point in the future. So
that's awesome. And it sounds like you guys have an amazing team working to incorporate medicine in action for everyone. So all of the students, when you're looking through your list of where you want to apply, because things are expensive, add them to the list. It was so wonderful to have you on our show. And for all of the students listening, you can check us out wherever podcasts are found and on YouTube if you want to see our facial expressions or whatever. And if you have any requests of any particular guests or topics that you want us to cover, feel free to reach out on our Instagrams at MedSchoolCoach, or on my personal one, Dr. D Graham, DOCTOR, the letter D, GRAM. And let us know what you want to hear. See you again next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.